Hi, my name is Brian Apavu. I am a neurologist with an interest in philosophy, the mind, and living the examined life. Today, I want to dive into another epilepsy condition that I have seen commonly in my practice in children, and it's currently referred to as self-limited epilepsy with centrotemporal spikes. The acronym is SELECTS. The condition has had a number of name changes, so you may have heard of it with different names, which include benign Rolandic epilepsy or benign epilepsy with centrotemporal spikes, which was referred to as BECTS. Self-limited epilepsy with centrotemporal spikes is the most common epilepsy syndrome, the most common focal epilepsy syndrome seen in children. It is characterized by brief, infrequent focal seizures, typically involving the face, a facial sensomotor symptom, where children will often have numbness in one side of their face, some clonic movement. It's hard for me to imitate it, but like a clonic movement of the face, some speech arrest, and actually some drooling on one side. And often occurs during sleep or upon awakening. The most frequent sort of way that I hear about these kind of patients is the parents wake up and find their child with a facial droop involving one side and unilateral drooping. Some families can be really worried that their child had a stroke based on the symptoms. Oftentimes, it will have that twitching associated with it, but not always. And that's just a common type of seizure that's seen with self-limited epilepsy with centrotemporal spikes. Sometimes it can manifest with generalized tonic-clonic seizures, and these focal seizures can progress from that facial twitching to more convulsive activity as well. So that's something to bear in mind. The incident and age of onset regarding this condition, self-limited epilepsy with centrotemporal spikes accounts for 15 to 25% of childhood epilepsies, with a typical onset between 3 to 13 years of age, peaking around 7 to 9 years of age. The seizures with self-limited epilepsy with centrotemporal spikes are usually brief, nocturnal, and they can secondary generalize, like I mentioned. They can sometimes go from just the facial twitching to generalized tonic-clonic activity. And like I mentioned, the semiology include the facial twitching, the speech arrest, behavioral arrest, and hypersalivation or drooling on one side typically. Most of these children have normal neurologic development up until the point that they have the seizures, and you often notice that's what's noticed during and after the seizure occur. But a significant proportion have comorbidities such as attention deficit hyperactivity disorder, learning difficulties, and mild cognitive or behavioral disturbances that we need to be mindful of. The mechanism of disease in self-limited epilepsy is centrotemporal spikes.